Good afternoon once again. We are doing the second recording of the day. Today I'm recording it for you all because after Holi, obviously we will be little low to warm up, but at the end of the day we will become very positive after listening to this lecture. But don't listen to these two lectures only once. Please listen to them again and again, at least two times. If you can listen to it three times, I promise you it's going to make your reading much better. Because in one time you are unable to accept because you have your own belief. Second time, you try and understand something. Third time, you try to learn. It does not happen in one shot because you have your own way. I have my own way, but we need to learn. In the first paragraph, writer uses Debbie's case to convey. So the only thing that this question wants to ask, what is the message of the writer when he is talking about Debbie's case? Okay, I will read the Debbie's case. Shedding light on CRPS. 11 years ago, Debbie had a routine bunion operation that changed her life. Instead of finding relief, her pain grew worse. Operation, pain worse. Excruciating, constant. She became disabled, stopped working, foot permanently in the air cast, walk with a cane. Most of the pain, 10 out of 10. Debbie's surgeon sent her to a pain specialist who recommended a psychiatrist. That means until now, the paragraph is that Debbie needs a psychiatrist because she is having pain. I knew, Debbie says, I knew the pain was not in my head. That means the pain was not psychological. So I don't need a psychiatrist, but the medical community did not believe. It wasn't until she met neurologist Aucklander that she finally received a diagnosis of CRPS. So overall, this particular message is telling us that Debbie's case after the operation was not solved by her surgeon. Her surgeon sent her to psychiatrist. Even psychiatrist could not solve her problem. Ultimately, neurologist was one person who gave her the diagnosis CRPS. So overall, this paragraph is talking about that CRPS is a kind of a condition that doctors even do not believe in. The dangers of having minor surgery? No, the topic is not talking about dangers. A lack of awareness among the medical fraternity? Absolutely yes. The psychological causes of pain? They are not talking about psychological causes. They are saying the pain is true and that is why diagnosis is CRPS. It's not psychological. That the specialist attention is warranted in such nothing like this. Warranty word is not given. You can easily eliminate it. That specialist attention is warranted in such. First of all, it is not making any sense. If by chance you think that specialist attention is required in such instances, they are not talking about it. They just are telling the story that even doctors did not believe her because they didn't know that pain can happen after the surgery. Even her surgeon did not believe. Psychiatrist, he sent him to psychiatrist. That means even the surgeons were not believing her. So there was lack of awareness. So if I have to do any question with ease, I will do this option as B. Then I will jump to question number 8. What is meant by the phrase tide is turning in the second paragraph? Now, this word is tide is turning means tide is changing. Tide is something that comes in oceans when there is moonlight. But anyhow, we're not talking about the real tide. We're saying tide is turning. That means the pendulum is shifting. Tide is turning. That means the pendulum is shifting. I can see this option. Doctors now believe in the existence of CRPS. This can be a wonderful option to be done if I have to do. Generally, normally I do not read the options, but I can see doctors now believe in the existence. So if the topic is about diagnosis, then this is the answer. Beneficial treatment is now more readily available. If they are talking about the treatment investigations, okay, I will read the paragraph only. Why to get confused? Okay, let's read the paragraph. Okay. CRPS is a chronic pain condition that develops following the trauma to a limb, such as surgery or fracture. As Debbie learned, this is a very controversial condition that not a lot of doctors understand. So medical fraternity does not understand this theory. Historically, the field of the medicine has been very skeptical of the patient with the CRPS. On the top of, so they're talking negative that medical fraternity does not believe in CRPS. On the top of their illness, patients have to navigate a medical system that is suspicious of them. That means first patient is having illness. On the top of their illness, they have to convince the medical fraternity, which is suspicious. That means they see the patient with doubt that patient is lying and has not had effective treatment to offer, and medical community does not have any treatment of this condition. It adds insult to the injury. So patient feels even bad that first I am having pain, then you are not believing me. It is like adding insult to the injury, just like adding salt to the wound. But those who treat CRPS are little hopeful that tide is turning. That means the people who are treating CRPS, like the neurologist Aucklander, that they are happy that tide is turning. Recent attempts to better comprehend CRP has produced consensus guidelines for which the patient outcomes should be included in the future research, as well as internationally agreed upon the diagnostic criteria. That means now the diagnostic criteria is being developed, and that is what it means that tide is turning, that doctors are now starting. And the line was saying doctors did not believe. Tide is turning means doctors have now started to believe, and they are making a diagnostic criteria. Investigators are also learning more about the causes of CRPS from the laboratory. That means now doctors have started believing. So this answer, if I have to do from this options, doctors now believe in the existence, this is like a perfect answer, that doctors now believe. That is why they are developing a diagnostic criteria. Beneficial treatment, they're not talking much about treatment. Recent investigations are indicating cure is in sight. They're not talking about the cure. Possible reasons for the multitude of symptoms experienced, no. So the only answer I want to do is doctors now believe in the existence of CRPS. A should be my answer. I know the answer is given wrong. If A is given, then it is all good. I don't remember. If A is given, then it's all good. Okay. Then I'm reading one more question for you. Just the last one, because we have to change the answer. Evidence mentioned in the third paragraph has revealed. So what have the evidence revealed? Revealed means show. What has the evidence shown in the third paragraph? Okay. This is my third paragraph. CRPS starts with the surprising amount of pain that does not match with the initial trauma. That means it keeps on increasing. Initial trauma is less, the pain is more. In the first few months, because it happens after the operation, instead of expected healing, patients describe the increase in the pain levels. That means pain increases. They often report that a cast on the affected limb, cast means after the operation, there is a cast over the limb, feels excessively tight, and the sensation that the limb might explode. And it appears that the limb might explode. The limb often swells, changes color red to purple. That means they are talking that the limb or the leg which is affected becomes bad, and bad color change also happen. Changes in the hair and nail growth and sweating also. They're talking about various symptoms which happen. Research from the Aucklander lab has identified persistent problems with certain neurons in the patient's injured limbs. So what happens is that there are certain neurons which get injured. So these nerve cells carry the pain messages. These nerve cells carry pain messages, but also control the small blood vessels and sweat glands. That's why sweating is happening. So all the sweating, everything is happening due to the nerve cells. Explaining why the patients have a constellation of symptoms in addition to chronic nerve pain. So overall, this paragraph is saying that patients is having chronic nerve pain, but there are other things like change of temperature, swelling, sweating, all those things are happening. That is happening because patients, the nerve cells, they are not connected only with the pain, but also with the small blood vessels and sweat glands. That is why there are multitude of symptoms which are happening. So if I go to question number 9, better post-operative care of the limb is needed. They are not talking about better post-operative care out. Temperature patterns remain consistent throughout the cases, but they were saying it is sometimes hot, sometimes cold. So the temperature is not consistent. I will tell you. I will show you. And is perceived by patient either very cold or very hot. So the temperature is not consistent. B is out. Further research is required in the possible cause. they are saying that it is the involvement of nerve cells that is causing the pain. So there is no further research. A out, B out, C out. The medical community understanding is beginning to shift. This also does not seem like answer. But then I realize, if I can, please understand, please, that is why I am doing this reading for you, these three questions. I think these options are interchanged. The paragraph that we read before, they were talking about that medical's community understanding is beginning to shift, that the tide is turning. This should have been the answer of this one. And this possible reasons for the multitude of symptoms experienced by chance. It will not happen in the exam by chance, but it should have been here. That possible reasons of many symptoms. What is the possible reason? Involvement of the nerve cells that causes pain, as well as they are connected to blood vessels and they are connected to sweat glands. That is why they are having multitude of symptoms. So in the end, there were like possible reasons which were given. I will show you again. Explain why. Why means reasons why the patient is having constellation of symptoms, means multiple symptoms. So I believe that these options have been by chance done up and down, and that's why the answers are given wrong. But if by chance you have done A, doctors now believe in the existence, this is a good option. But better option is this. Medical community understanding is beginning to shift, and that is MRING, the tide is turning. So the community is beginning to shift, and this answer should have been possible reasons for the multitude of symptoms. Can't help the reading, but yes, you can change this thing. And if by chance these two questions of you are wrong, you don't have to blame yourself. You are very, very good at reading. It's just sometimes OET readings, couple of questions are here and there, but you need to get yourself sorted. This is Dr. Bhupesh. Please listen to this recording again. I promise you, I understand that you have understood little less because you have listened to this recording once. Listen to it again. You will feel better. When you will listen to it third time, you will understand everything. And that will guarantee that you will pass. It's just listening to it 3 times. Thank you very much.